I'm Laurence Mitchell, and I'd like to know how important your health is to you. I'm not talking about me, but to you. There's a reason why I'm saying this. I'm sure you're a very healthy person who has a very healthy mind. You go to your doctor on a regular basis, especially when something may happen to you, or perhaps you don't. It's not just about going to your doctor, it's also about asking the right questions. That is, knowing how to ask the right questions. Now, I'd like to tell you a little bit about me, and unfortunately, I just came through a major crisis in my health. Fortunately, I was able to pull through, but when I was told what happened to me, I got very, very scared. Anyway, by listening to my video might help you be a little less complacent about your own health. You might decide to make some changes. I hope you do. I hope they are for the best. Anyway, this is my story. Many years ago, when I was a child, about 12 years old, I learned that I had congenital malformation of the bones in my arms. I had a condition that was mimicking paralysis because as I went through my adolescent years, the bones in my arms started growing out of proportion to the rest of the bones in my body. My parents took me along to a number of leading physicians who told me, yes, Laurence, will have to be operated on. Which arm do you want operated on first, left or right? Anyway, they decided not to use conventional medicine. There was this great guy called Joseph Goodman. He was an osteopath and acupuncturist, and in fact he'd already been out in China and learned about acupuncture out there, and using a combination of homeopathy, naturopathy, osteopathy, acupuncture, and putting me through a vegan diet for 2 years, he was able to alleviate the symptoms. God, was I relieved. I'm sure my parents were even as relieved as I was. Anyway, as I grew up, although there was a period of my life that I was eating meat, I eventually turned to becoming a vegetarian. Not a vegan, a vegetarian, because I did enjoy my dairy, especially eggs and cheese. I didn't drink so much milk, but as time progressed and I got married and I developed my own diet, unfortunately I had a problem that I didn't know about. It was like having one's own demon inside of one's head, and I had to wait until I was 49 years old to learn about this demon. It was called Asperger's syndrome, and so this Asperger's syndrome, who had a relationship with ADHD, that's attention deficit hyperactivity disorder, OCD, which is obsessive compulsive disorder, meant certain things I didn't have much control over. For instance, like cravings. When I was younger, I used to go through so many cakes, so many sweets, chocolates. I just didn't take one bite. I took hundreds of bites. I would go into a patisserie and order a dozen eclairs, a dozen of fresh cream slices. I'd go into a sweet shop. Even as an adult, I would do this. I'd go in and have a couple of bounties, a couple of picnics and other chocolates and sweets, thinking nothing of it. The problem was, once I took that first bite, I couldn't stop. And I wonder how many of you out there are thinking, well, we have the similar problem that Laurence has. Anyway, so here am I trotting along. And because of my interest in autism, I managed to go to lots of autism conferences. I started getting very interested in natural health, going to professional natural health conferences, mixing with all sorts of people in different sorts of fields. Then I happened to get involved with Research Autism and National Autistic Society, and I went along to their conferences and spent time in North America going along to many autism conferences there, mixing to all sorts of people. And I changed my diet, very much a vegetarian, watching the cheese and dairy that I ate. But one thing I couldn't still stop, and that was my craving for sweets, a craving that I still have with me today. and something I have to be very, very careful of. What I didn't realise is certain other things were going on in my body. And perhaps all the junk food I was eating was actually counterbalancing all the healthy food. So my body actually was going out of control. 5 years ago, actually, I suffered from nervous bladder, enlarged prostate. Thought nothing of it. I watched something on the internet telling me if I changed my kitchen utensils and went away from Teflon, then this would help my nervous bladder. And lo and behold, I did exactly that. I went and bought out a new set of saucepans, and I suddenly found my sort of peeing returning to normal. I didn't have to worry to stop every 10 minutes when I was driving my car. Anyway, early this year, I started getting the most intense constipation I've ever had in my life. I went to the doctor about it. As far as he was concerned, he couldn't see any signs of constipation. Thought nothing of it. And about 2 months ago, I started developing the most terrible kidney pains. Unbelievable. It was awful. And abdominal pains. I felt like there was a snake inhabiting my intestines. I went from one hospital to another, that is walk-in hospital. I saw a multitude of doctors, including my own. And the best that one of them could come up with was that I had diverculitis, and he actually gave me an antibiotic for that. But I then said to him, "Excuse me, why are you not insisting on I get a blood test?" And he said to me, "Because I've examined you, and by what you're telling me and the fact that you're not really feeling that much pain, the pain is nothing particularly definite. I don't see anything major wrong with you." So here am I, thinking there's nothing really wrong with me. But I insisted on getting that blood test. I'm so glad that I did. About a week later, although no one actually called me, I called the doctor's surgery to find out what happened on the results of the blood test. And I learned that they're concerned, but not concerned enough to call me. Anyway, about a week later, I went and got another blood test. Now, on the 14th of November, I was given a talk at Research Autism, a talk I really wanted to give. Felt it was important for people to hear this story. I'd been planning for the last few months. It's about my life at school, my bullying, and all that sort of thing. Anyway, at 8:15 in the morning, I got a phone call from another doctor who had recently seen, who said, "Laurence, are you on a train where you better get off at the next station, book yourself into the nearest emergency hospital. Your kidneys are working at 10% of their functionality. This is a life-threatening situation. You've got to drop what you're doing." And I said to him, "But I've got this talk to give." He says, "Oh, I'm aware of that, but you have to decide what's more important." Anyway, I decided that I'd lasted this long. I would go and give the talk because right next door was UCH hospital. And I gave my talk. And after the talk, I went to the hospital. All I can say, I'm so pleased I did. They said to me, "You know, if you hadn't walked in here today, you might not be around in this world tomorrow." Within an hour of me going in there, they must have realised, just looking at me, that I was not a well man. The doctors there were far more trained than my own doctor. And they checked me over, went over, looking at my eyes, my mouth, my nose, my ears, my neck, my ankles, my toes, my fingernails, everything you could possibly think of, they checked, and they put me on a heart machine, and eventually they took their own blood test. They wanted to start from scratch, and I must take my hat off for the staff, for the doctors and nurses at UCH, because they did a wonderful job, and that I praise them. They saved my life, and I wouldn't be here to give this little talk to you. So I implore, I encourage you, next time you have a pain that you don't understand, don't just write it off. Go to your doctor. Insist on a blood test. Don't allow him just to pay you off by giving you an antibiotic. I'm grateful I didn't use the antibiotics. I'm against antibiotics, but there are times when you do need to take medication, and I chose to take the medication that the doctor at the hospital gave me to reduce my prostate.